Afternoon, doctor.
Good afternoon.
What's the one thing patients are always surprised of when they come in for a consult?
If they're surprised, everybody is prepared now. Our patient care coordinator does a good job of talking to them beforehand. They know what to expect. They have an idea of what they're getting into when they walk in the door. So I don't think people are surprised. They're surprised at how big my hands are.
How long should someone wait before they come in for surgery after a consult? What's the proper waiting time?
We don't like to operate right after the first consult. We like people to be able to think about things and review what concerns they may have, but it's any set time.
Is there one procedure that people wait too long to do?
Yeah, I think after pregnancy, waiting too long to get that pre-pregnancy body back. You don't want to wait until you're 65. You really want to do something after you're done having kids.
What makes a great result of any surgery?
It's really attention to detail, all the details along the way. Mm-hmm. That's why our instruction sheets for post-op instructions are 5 pages long, so that people do what I say. And not everybody likes to read all that paperwork, and it's frustrating when patients don't. We take the time and to lay out all the little things that are important for post-operative healing and getting a nice outcome. So it's really that attention to detail from both us and what we're doing and in the patient's aftercare.
What do you look for during a consult and patient readiness?
There are a lot of things. One is they have to be emotionally prepared, doing it for the right reasons, have the medical issues too, that if they have any cardiac issues, we want to have those cleared by the cardiologist. Diabetes, we want to have their blood sugars under control. Weight, we want to have that with a BMI under 30 in almost all cases, although that doesn't apply for all surgeries, but most of our big surgeries we like to have a lower BMI. In addition to all the medical issues is just the psychological issues, and also having support and having somebody at home that is on board and is willing to help them.
Do you prefer early mornings or late for surgeries?
I don't know. I don't mind sleeping in, but when I don't get to start early morning, then there might be another surgery that goes in front of us and delays us, and then patients can't eat or drink anything, and it can make them kind of hangry. So that first case early in the morning is usually better.
Recovery is always painful. Is it true or false?
False. FRAP's been great. It's really helped us minimize narcotic use, and I think we're getting pretty close to this point where I don't need to prescribe narcotics post-operatively for a lot of the procedures that we do. And the main thing now is holding patients back from doing too much so that they can heal and not have problems.
Implants or fat transfer for a natural breast look?
For a small natural look, fat transfer, but that is a small size change. I really like fat as a correction of small differences between the two breasts. It seems like it works well because you can't put a large volume of fat in there. If you want something larger, then an implant is the answer. If you're getting the implants removed or having problems with implants, then fat transfer is a good option because it can help replace some of the volume that's lost when the implants come out. We could use, now there are new products that are out. Aloclay is one that we've been using to help with restoring volume when we need more volume. Renuva is another one that we use to help with the fat graft take that gives more of a growth factor push. It just depends on the case, and really it's the kind of thing that you need to come in the office and have the discussion about so that we can decide which is best for you.
What procedure do you feel is most like art?
That's my welding.
What surgical procedure would you say is most like art?
I never considered myself an artist and really considered myself more of an engineer, and when I make marks, it's more of a engineering kind of outline. Now that I've been welding and creating art with my welding, it really translates to the artistic approach, engineering and artistic approach that is really all of the things we do. To me, one of the biggest artistic ones is the nose, because that's something everyone's always seen, and it's a three-dimensional thing. The nose is probably a big one. Breast surgery is another one that's really an art, because it too really depends on a three-dimensional look. And looking at some of the reconstructions that we are doing now, and they really are looking better than they did before. It used to be 30 years ago we were happy just to have something there. Now with advancements and graftings and things that we do, ancillary things that we're doing, we really are looking almost better than they were before surgery. I think having that reconstruction background and having improvement in the reconstruction leads to improvements in cosmetic surgeries too, and vice versa. The cosmetic improvements are helping the reconstruction patients.
Do you make your bed every morning?
No. I just roll out as best as I can.
Sourdough baking.
Yeah, so the sourdough bread is not so much a hobby, it's something you gotta have bread. So sourdough, it's usually a weekend thing. The nice thing now is I have a rhythm to the sourdough. So I can keep the starter in the fridge through the day. Thursday or Friday, I can start taking it out, feeding some, depending on what I have planned for the weekend. So like this weekend, for instance, if all goes well, I will have whole grain sourdough that has a multigrain with oats, seeds, nuts. I'll have a plain sourdough loaf that is just your run-of-the-mill sourdough. Sometimes I'll make a cheddar jalapeno with Mrs. Conero's jalapenos from the garden. Also do pizza bread in my new pizza oven.
Ooh.
Pizza dough in my new pizza oven, or sourdough pizza dough. Or I'm thinking this weekend I'm going to make some of the naan in the pizza oven using my yogurt in my sourdough.
Because you're also fermenting your own yogurt.
Yeah, double fermentation.
Nice, nice. Well, any other questions that our patients or followers have, you can post them below. And other than that, thanks for the Q&A, Doctor. We'll see you again next week.
Thanks.